Hello and welcome to yet another episode of Meet the Masters. In today's episode, we have a very special guest who is the Deputy Medical Director of Saga Hospital, Bangalore, and it's my pleasure to welcome Dr. Bidhari Rajendrakumar to our show. Welcome to the show, sir.
Yeah, thank you very much.
First of all, we would like to know more about you.
Yeah, I'm a doctor from Karnataka, born and brought up in Bangalore. I did my graduation from MR Medical College under Gulbarga University, and further that I joined St. John's Medical College in Bangalore. Then I worked in trauma and orthopedics, followed by after that I went to England, and I did my specialization in the emergency medicine and critical care. There also I had the hospital management experience in the United Kingdom. I'm being the beneficiary of United Kingdom. I learned a lot of things about not only managing the patient, also managing how to manage the hospital. Well, that was one of the things. And later I had been to US to do my master's in hospital management. Following that I came back to India. Then I joined one of the leading first cardiothoracic center in Bangalore, which was doing cardiothoracic surgery, bypass, and top consultants we had, best of the best those days. And then I had a chance to be associated with the Manipal Hospital, where I met Dr. Devi Shetty, these kind of well-known figures in cardiothoracic surgery, and Dr. Ranjan Pai, who is the promoters of Manipal Heart Foundation. I was in Manipal organization, worked in the corporate level. We did initially had started wellness programs and wellness clinics and across the pan-India presence. And I set up two institutions, medical schools like Vaidehi Medical College, and also followed by I joined the Saga Hospital. Saga Hospital is promoted by Dr. Hemchand Sagar, who is the chairman, and Premchand Sagar is the vice chairman. And we have two hospitals. One first was started with collaboration with the Sagar Apollo. It was that is in Jayanagar, Tilak Nagar, and the next where I am based at, that is Sagar Banshankari we call, Sagar Hospital Banshankari. This facility is about 465 bed hospital. Yeah, this has got all the super specialty treatment facility, including general surgery, gastroenterological surgery, cardiothoracic surgery, neurosurgery, pediatric surgery, plastic surgery, and urosurgery, endocrinology and neurology. All facilities as a super specialty hospitals will have. And we have one of the best infrastructure. Even our hospital was nominated for the best infrastructure in the India. Our hospital, it's like a 5-star hotel. We have good facility with deluxe rooms and private rooms and semi-private rooms. Also, we cater for the general, few general wards. We have facilities like, our critical care unit. We are the first people to have a cubicle critical care where patients are been secluded from other patients. You cannot see the next patient there. You're individualized, like you're in a room, but still you're in a common. So that's how. It is one of the beautiful facility we have. And we have 24 hours emergency services where looked after by the qualified emergency physician. And we have critical care physicians. Also the 24 hours support is given by the anesthesiology department, and there are 24 hour surgeries do happen. We have a cath lab and a post-op care cath lab which supports the angioplasties and cardiac procedures. We do a lot of valve replacements and cardiothoracic surgery. We also do the cardiac bypass surgeries and as well as other procedures. And our cardiologists and cardiothoracic surgery, we had a team, very good team we have. Plus, we also have a neurosurgical team.
Okay.
Yeah. We have teams where the consultant and the in-house consultant, also the registrar and junior doctors, where it descends down with the special care. And we also have the facilities for the labor. I mean, the maternity care we provide. We have a pediatric facility and the neonatal facility, which supports the general pregnancy and the antenatal and postnatal care. Also pediatric departments. We have best of the radiological imaging facility like CT scan, MRI, 1.5 Tesla MRI and the 180 slice CT. We are the first people to have in Bangalore. And our facility is supposed to be like a 5-star hotel. Best of the best cuisines are made for the patient attenders. We get a lot of medical tourist patients from Nigeria and Gulf, from Dubai and Bahrain, Oman. We also run our clinics in Oman and Dubai. So Sagar clinics are there to support us. We also have facilitators in Nigeria. And we do promote medical tourism because one of the reasons is that our facility supports. We have the best of the best infrastructure. And we are the first people in Karnataka to get certified for hospital infection control. That is NABH SAFE-I is the first hospital in Karnataka. It's certified by the National Accreditation Board of Hospitals, QCI, under QCI. And we also getting certified for the medical travel certified hospital. And we are in a process to get JCI accreditation and other quality. We also, at the moment, we already have ISO in practice, ISO certified hospital. So that takes, that gives a lead to us, and it is a privileged place, and people feel at home when they come. And we have a translator to translate them and make them their food habits are looked after, the transport is looked after from them, and they pick up to drop. If there is any uneventualities are also taken care. And we are also very economically well placed. We are not just money minded, but we give services to the people. They should feel good about it and also feel healthy. Safety is the main concern of our hospital. We safely receive the patient and safely we discharge. That is our main motto of healthcare. And we, in our objective and mission is basically, we care about the patient. We feel that we give the care to the patient so that they do not feel that they are at a different place. They're at home. And also we look after the safety and their moral support we give them. They should not be scared of any. And we also, we are one of the best place ethically. We follow all the rules and regulation of Indian government and the overseas. We respect people's religion and also their method of cultures. If they require any support in that regard, we definitely provide them. Like most of the people come for prayer, we have a place. So that kind of things, and the food habits, we have a special 2 kitchens. One is for the medical tourists and one is for this thing they can place an order. Also, if at all they do require food, we get them from outside as well.
Okay, that's good. So, sir, now could you just tell us your experience working in Saga Hospital?
Yeah, when I joined the place, it was it's a beautiful place. It's a 465 bed. It's kind of a 5-star hotel. I like the property very nicely, the beautiful infrastructure. We were also nominated for the best infrastructure hospital. And looking at that, I always have worked to the places which are the best in the world. When I was in England or even in Bangalore, Manipal, and kind of like things. And Sagar Hospital also competes as the best hospital building right now we can take. It's like a 5-star facility. Here, after I joined, I introduced a lot of patient-friendly methodologies to attract patient. Also, I did the quality management system. We are the first hospital to be certified as hospital infection control. NABH CFI, that has been certified by the National Accreditation Board, QCI. And this is the place where after the certification we have a lot of changes in the management of the patient. We take care of the patients like infusion safety, injection safety, healthcare worker safety and patient safety, and waste disposal, in a proper manner. And also the sterilization and the disinfection part of it. Everybody has to wash hands, not to pass on the infection to others. We have added the isolation rooms where patients are protected, like infected patients are secluded, where they're given the negative pressure care, where others are not affected with the... These are the best part of it, and there have been a lot of rejuvenation in the management and the encouraging our employees to work better and also attract patient of the international standards, even the local domestic patients. We have a very big ticket size. Most of people come for the cardiothoracic surgery care, for bypass, angioplasty, all emergencies. We provide them the best, like if myocardial infarction is a heart attacks and all, immediately taken to the cath lab. So within hours time, patient is all right. That kind of a care is given, and it's 24/7 facility which runs. And I provide the most of the a thought process that how the hospital should be, because whatever experience I have gained from overseas and in India and domestically, I put in all my efforts to make it more patient friendly and market friendly, also to the healthcare industry contribute. We also follow the Swachh Bharat is there. Our hospital also is very clean and very tidy. So I'm in the process of getting this clean hospital program certificate. And like I just said also before that, we'll be getting certified for the medical travel certification as well. Further to that, we'll be doing Joint Commission of International Certification, JCI, to improve our quality services in hospital and make it more internationally, international level of standards we follow in our hospital, so that patients, domestic patients and international patients should feel comfortable coming to our hospital and should not have any hesitation that they cannot go safely. So we care about the patient care, the safety issue, then the infection, and less cost, more effective, more services. We have additional services, like we have a gym and spa facility in our hospital, and a beautiful campus behind for the walk, where Dayanand Sagar Institute is there. Also, we will be adding some more facilities like daycare and supportive systems. And attached to that is that we have a good dietary for the patient who do not really need to go outside to have their food. Morning breakfast is served, then the lunch, tea, coffee, everything on the board. Yeah, it's a best living facility and the best hospital and to get treated in town. And we are upcoming with further new facilities and new campus. They would like to start university and medical school as well.
So now what are your insights on medical tourism?
Yeah, medical tourism is a growing industry. I mean, since the inception, this thought process has been happening past when the India took reforms in the process, like you can say somewhere in 80s. Previously, we used to see patients coming from Gulf to going to Chennai or Bombay was the nearest place which used to go. But off lately, like Bangalore became a center for cardiothoracic surgery, bypass, and all those things. People started coming to Bangalore. We earlier to my place where kidney transplants were done. People would come from Gulf and other areas for having transplant. We're also in the process to start a transplant, organ transplant in a Sagar Hospital, Banshangari, where the kidney transplants and liver transplants will be done.
Okay.
Yeah. So we'll be adding these facilities to enhance and get more coverage of the patient. Plus, also we are adding the value for their money, you know. We just do not treat the patient, but we also see that they come back to us. They should feel comfortable, one thing, and the trustworthy. We are, though we are a corporate facility, but still we run like it's a kind of a trust. It's been run, and we care about people, and our chairman and all. They think that they owe to the society. They contribute to the society's problem, and they try to pass on this healthcare to everyone living there. Plus, people who are from abroad whoever would like to come and seek help or treatment, we're quite open and ready to it.
So lastly, what is a message that you would like to give to the audience?
Yeah, I mean, if you would like to come to Bangalore, please walk into Sagar Hospital. We take care of you. By all means, if you have any problem, you can approach me and my colleagues, my international team where they're dealing with the patient, international patient care services are there. So we'll be at your service 24/7. So we make medical tourism friendly hospital. So we also have the membership facility for those people who come to us, get member and membership facility for the patient who come. They can follow up that, they get some reward points, and it's kind of, you know, like they get a concessional facility, at times discount on some of the facility charges.
That was nice talking to you. Thanks a lot for being a part of our program.
Nice. I also enjoyed to say something good about it. Thank you very much.
So that was Dr. Bidhari with us. Until we meet next time, this is me, Nana, signing off. Take care.